Welcome to Find Your Shape, a podcast by Lewisburg Plastic Surgery featuring Dr. Alexander Moya, the expert in body contouring after weight loss and inventor of the Corset Body Lift. Hi, my name is Brittany, and I will be your host. In each episode of this show, Dr. Moya and I will discuss the complex world of body contouring after weight loss. Our goal, as with everything we do here at Lewisburg Plastic Surgery, is to provide you with the educational resources you need to make the best decision for your personal situation. You've lost the weight, now let's find your shape. Well, hello again, Dr. Moya.
Hi, Brittany. How are you today?
I'm great. How are you?
I am great too. Again, looking forward to our next session here of our podcast.
Me too. So I want to talk about thighs today. We've discussed inner thigh tucks previously. We've discussed calf tucks. That's all well and good, but what about those sisters out there that have like bigger saddlebag areas, have more complex skin concerns? What do you do for that?
We do have some treatments for that.
Good.
So the first, if we're looking at the outer thigh as an area of concern of loose skin, the first procedure that we always do would be what we call an outer thigh butt lift or a posterior body lift. Basically, you're lifting the outer thigh, and the incision is along the waistline. It's part of the a lower body lift if you're doing a 360-degree tummy tuck.
Above the butt.
Correct. So it would be part of that procedure. And that's for another discussion in and of itself when it comes to procedures. But if somebody already had that done and they say, well, Dr. Moya, I still have this saddlebag. You know, the procedure did not resolve it completely. What do we do? Well, there's only one thing left to do if it's that much of a concern to the patient. And you can kind of see because it disrupts their contour. Instead of having smooth outer thigh hips, it's like all of a sudden you have some smoothness and all of a sudden there's a pop out. And then it comes back to a waistline, nice smooth waistline. And I get it. That disrupts the shape of the patient. So I don't like it either. The only thing I found that works for that, meaning we can guarantee now that you will be left with the right shape, very smooth outer thigh hip area, is to cut it out directly. So what does that mean? Well, it means that now this patient has to have a scar across the top of their outer thigh. So basically what you're doing is you're removing the pocket. So those patients who have truly these large saddlebags, I mean, they just big pop-outs. The skin is stretched in that area. It's like a pocket of skin. So you can imagine, even if you lift up, if you don't actually cut into the pocket, then it's still there.
Still heavy.
It's kind of like we talked about these constricting skin bands, right? If I lift up the skin, pull it down, everything looks good, but you still have the band there because you haven't cut it out. Same problem here. These patients have an out pocket of skin. It's a pouch. The only way to get rid of that pouch is to cut it out.
Is that an up and down scar then on the outside?
It would be a side-to-side scar because that's how the saddlebag, you go with the shape of the saddlebag. The saddlebag is really side to side.
Okay.
And so what I do is it's a pretty straightforward, simple procedure. We kind of pinch it together, see how much skin we're going to take out. You know, we do what's called tailor tacking, mark it out. It ends up being like an ellipse. And we have a little bit of leeway. We can angle it in the right direction because the skin lines of the outer thigh do go in that direction, meaning there's skin lines all over our skin, which can hide scars better. And so they go somewhat in that direction, so we can kind of design the removal along the skin line so we can hide that scar a little bit better. But it is a trade-off because it is a more visible scar. It's on the outer thigh.
Right.
The patients that I've done, they really disliked that part of their body, and we did everything that we could to make it better, which, like I said, is usually an outer thigh lift, part of the lower body lift procedure. Sometimes I do a lot of liposuction there to see if I can improve that. But if it's not enough, then we can do this outer thigh tuck, I call it.
And they're willing.
Like tucking that area.
Right.
Yeah, and I have some good pictures of it. I actually have some on my website. It gives great shape. It's normal shape.
Right, and they're willing to take that scar versus having that.
Correct, because they want to be normal. They want to have normal body shape. So I customize everything. I'm not afraid to put a scar there if I feel that I can guarantee that body shape.
Right.
If the patient is wanting to have normal body shape, we don't have to leave them with something and say, sorry, there's really no good procedure for that because we're afraid of putting a scar there. this is something that I decide with each individual patient, what do they want?
Right.
And if it makes sense to me in my head, and it makes sense, and I feel that my patient understands what that means, and I feel that they really want that, I'll go ahead and do that for them.
Mm-hmm.
And I've had no patients unhappy for the few that we do. It's not a very common procedure,
Right.
so let's not say, wow, is that no, it's not very common. Most patients, if you do a nice outer thigh butt lift, aka posterior bi lift, it can take care of that area fairly well, or enough. Let's say enough.
Right.
That patients know I don't want a scar there.
Mm-hmm.
But there is a solution for those that really want that
Well, good.
done.
What do you do for compression on that area?
That's a great question. Nothing.
Nothing?
No.
Okay.
Because there's usually I don't have to do liposuction. If I do, then again, I'll add it for feathering if there needs to be some feathering, because it's a direct cutout. Basically, I'm pinching that skin, cutting it out. There's no lifting of skin. It's an area that doesn't really swell. There's nothing that you can really do to it, walking around or whatnot, that's going to cause it to flare up, let's just say, after surgery. You just have to be careful that you're not going to, fall on it or bang it against a chair or something like that.
Right.
But it is a more straightforward procedure. And again, for the patients that want it, they're very happy with it. And so it's one of the things that we kind of make it up like everything else. Right. And I call it an outer thigh tuck.
Okay.
Because it kind of makes sense. You're tucking that area
Right.
in.
Correct.
It's either tuck or lift or cinching.
Something like
That's
that.
kind of what I do.
Yeah. Okay. Very good. All right. That's very interesting. All right. Well, thank you for that.
All right. Well, thank you, Brittany.
That's a wrap on this episode of the podcast, brought to you by Lewisburg Plastic Surgery and Dr. Moya. Please be sure to subscribe to our show so that you never miss an episode. And for more information on Lewisburg Plastic Surgery or the Corset Body Lift by Dr. Moya, please visit us online at lewisburgplastic.com. We'll see you next time.